6 months, delaying further by an extra 6 months for someone to graduate. And that is intended to cure a lacuna that has been existent, that has been existent, because of the gaps that we have observed during the training of our healthcare professionals. So I kindly urge all of us to go back and read this policy. Just focus on the sections that concern you, that you have interest in. But when you're reading them, do not read them in isolation. Read them together. Read the principle in the policy. Come look at the standard that relates to that principle that has been stated in the policy, and look at how it's going to be enforced. And at the end of the day, we can always have another feedback engagement where we can always interact. Jacob indicated that we should have these sessions more often. I am very open to that. And in asking us to respect each other, Dr. Frank, I need us to be clear with each other. I am not threatening anyone. And I'm only asking that we should respect each other, because we assign people here and no one is here to abuse any other. Thank you so very much.
All right. Thank you, Dr. Ronnie, for that response. With us, we do have the guild president, I'd say past guild president, and former Secretary General, Ariho Lucky, who had a few. He's also looking forward, actually, supposed to be among this first cohort that is coming in so they're most likely directed or directly affected by this policy as it's rolling out, as you said. And he had a few things to put across. Hopefully you would be in audience. Lucky, are you there?
Yes, I am. Thank you, Yosia. Okay, I'll go straight to the...
Ralph, maybe before Lucky comes in, I would wish to state, someone asked a question whether I did internship. Yes, I did internship, and I did internship in 2 different hospitals. And for the record, at least you can go and look up my records. I got outstandings for both my rotations. Thank you.
Thank you, Dr. Rennie. Thank you for that. I'll just start with that shortly, but I won't dwell on it. I am very sure during this internship, you were paid an allowance, and I am very sure it made a very big difference in you navigating through the internship. Okay, and I am sure this is the same case for our former minister, our current minister, and even the PS of Ministry of Health. So we have seniors who passed through certain conditions, but they've gotten there and they have failed to defend the same welfare benefits that enabled them to go through a hard period like internship. But that is not what I'm going to talk about. Many people have talked about that, so I won't dwell on it so much. One of my biggest concerns, Doctor, is that document. I read it properly, and it said somewhere that this policy will start affecting people, will not affect people who are in their current deployments, either as a student or as a resident or as an intern. You have clearly stated that it is not going to affect the current interns. They won't be assessed with whatever assessment that you are talking about. Now, my question is about the students. I want you to clarify, for the benefit of avoidance of doubt, I want you to help us and clarify. We have already been admitted as students. All the current medical and healthcare students in Uganda have been admitted as students already. They have contracts with the university. You have kept dodging that question, and I don't like it. They have contracts with their universities. I was admitted in 2021, and I'm supposed to graduate in October 31st this year. Actually, my graduation date is already set. And within 1 week, I'll be done with my medical school exams, the very last. Now, you come up and you're saying that I can't graduate in October. On 31st October, I cannot graduate. And I have to go do internship. And then I'll have to graduate in October 2027. Okay? After 2 months after internship. Yet, ideally, the moment I finish internship like this, I should be able to immediately get my license if I have passed. Now, that is one. Two, Dr. Ronnie, you also know very well that Uganda, actually, I have seen several reports, medical doctors, let me speak for medical doctors. They are some of the least motivated healthcare workers in Uganda, and they are the people who are most likely to leave the profession. Now, instead of creating more welfare for doctors to stay in their profession, the ministries, the government and the different ministries come up with strategies actually to chase more doctors out of the profession, making us, feel less appreciated. People want to leave. My point in all this is that people want to leave the country. Actually, me, I am thinking about starting to mentor students, medical students in Uganda, to start a general movement for USMLE pathway, so that students finish their degree, they do USMLE and go abroad and work from there. So why are you blocking someone who potentially wants to do licensing exams of maybe another country, right after graduation? Because the Ugandan license, even if you get it, you cannot use it anywhere else in the world. You have to get a license for that place. Why would you block that person from graduating and getting their transcripts? Okay, yet they can go and have a better future elsewhere. Please, I would like an answer in that. Now, for the contracts we signed with our universities, we were admitted at a certain point, and we're supposed to graduate after 5 years. My admission letter clearly shows after 5 years, I will be conferred upon a degree in Bachelor of Medicine and Bachelor of Surgery. How does a policy come and stop me from graduating in October, yet I have fulfilled the requirements that the university demanded of me? Okay? So if this policy is coming, we as medical students, as current students, we are saying at least give the policy an option to the students who are getting enrolled into this profession starting with year 1 in August this year. Okay? If they want to join the profession that is going to be having a course for 6 years or even 7 for some universities, let them join. But us who joined, knowing this is a course for 5 years, please let us graduate, including the current year ones. That is my request of you. 2, the internship, the end of rotation exams that you're talking about, okay? What are they going to be like? Are you guys going to wait for us to get there and then you start experimenting with us? Has an examination been put in place yet? Has a board for that examination been put in place yet? Has a committee to monitor and regulate internship in the country been put in place yet? Are all those supportive structures for these changes that you're proposing already in place? Or you want to experiment on us like the new curriculum in O level, okay? And A level. You want to just experiment with us. Do we have a tested system? Was the system benchmarked in any other way?
Is it my device that's disconnected or we lost Lucky?
I think he has been muted.
Am I allowed to proceed and respond? And I will kindly request that this.
Okay. Dr. Ronnie, let me summarize. Someone had muted me. I don't know how. So finally, Doctor, as the guild president of MUST, which is the second oldest university in Uganda, I have been seated on the university senate and the university council representing students. Now, my concern is every time, universities, just like the country, we have a parliament which is, really not doing much apart from passing laws and regulating the government. So sometimes people tend to get a bit idle and they want to bring up new things. But every time new policies and new things are brought up without proper consultation of the relevant stakeholders, because I heard you mention stakeholders several times, very many times, and I did not hear you mention students as stakeholders at any one point. Okay? Every time policies are introduced that do not involve all the stakeholders, there is always issues coming up. Now, I do not know why you have chosen to completely ignore the stakeholder that is a student in all these consultations that you people claim to have made, and what your plan is for that. Thank you. I beg to submit for now.
Is it time for me to respond? Who is the moderator?
Yes, please, you are free to respond. Please.
Okay, thank you so much, Ralph. Lucky, thank you so much for your questions that you asked and the submissions made. In one of your submissions, you ask if I do not want to practice medicine, why are we blocking your career path? Colleagues, I already responded to this and said every house has got its own rules, and every game has got rules of engagement. The current dispensation of medical training in the country requires that when a person completes their formative training, they are subjected to a final exam, and upon satisfying that exam, they graduate and they are ready for medical internship. And this policy, which is being developed by the same institution that pretends the institution that puts in place universities under the universities and other tertiary institutions, the National Council for Higher Education, comes out and creates an adjustment in its principles or in its rules of engagement and says, hey, wait a bit. If I have been doing this way, I have observed 1, 2, 3 challenges or gaps, and I am seeking to adjust in my rules of my house. And the rules of my house now are going to be, if a person has got to complete medical training, they'll have to they'll have to complete internship first before they can be conferred onto the degree. That is an adjustment. It's allowed within the principles of law, and this law did not, or this policy did not breach any law. Otherwise, if it did, then it would never have been signed off at cabinet as a policy that was valid, because for a policy to be processed, it goes through a rigorous process that vets it against merits of the principles that are being processed, so that they can, with the clear legal advice of the Solicitor General, who is the chief principal custodian of the law for the government of Uganda. So if the policy now says that the terms of reference will be for a person to have completed medical training in Uganda will have to undergo a medical internship first, that is an adjustment in the principle. And we need to agree that that principle adjusted not for the bad, but it was attempting to cure a lacuna that I already alluded to, where we were having a growing number of people that were in no man's land after failing to complete one of the cycles. And this was hinging on aspects of quality. In response directly to Dr. Frank's submission on having only 8 people as a number or as a statistic that should not be treated as significant, I wish to interest you to the aspects of significance of results when it comes to principles of public health, which you will, perhaps we will engage after here, and you'll agree with me that the trend was not a very good one for our country. And instead, the population to say that we are trying to disadvantage by putting in place these principles is what actually the principles of this policy are seeking to ensure they are in place to protect. Because we realized that the quality of healthcare providers that we were producing as a country was not meeting the standard, and therefore there had to be another level of intervention that was seeking to adjust that quality so that it met the bare minimum that would provide safe healthcare services unto this country. I would wish to re-echo this. There is no any curriculum adjustment that is being made. The contracts that we are saying that we have with the universities, that is okay. Like I indicated, in the policy, all laws that establish all these institutions that we're talking about, the National Council for Higher Education, the Uganda Medical and Dental Practitioners Council Act, the Uganda Nurses and Midwives Act, the Uganda Pharmacy Board Act, the Pharmaceutical Society of Uganda Act, all acts, the Universities and Other Tertiary Institutions Act, the TVET, the Technical Vocational Education and Training Law or Act, were all referenced in making sure that this policy was in alignment. And the prescription is such that this policy will be interpreted together with all those policies or laws. There will not be any time that we will read this policy in isolation of those laws. So there is no any curriculum adjustment. Rather, what the policy is calling out for is a delay in the timing of when a person graduates, so that we cure the lacuna that was being created by universities that are not doing a good job producing half-baked products that were untrainable, that were a danger to the population of this country. And at the end of the day, these people were being found to have already titles conferred unto them, and you cannot reverse them. What this policy is curing is that gap, such that you do not get a title before you are eligible for it. By the time you get the title, similar to what Dr. Frank Asimwe mentioned, you will have been deemed as eligible, you'll have been deemed as safe to receive that title, such that you cross over to the other side of practice safely without any troubles. Whoever will not meet the minimum requirements of crossing over will have room to renegotiate back into the education and training phase, so that they are drilled further the universities will take the responsibilities of drilling these people further or molding them further and representing them to the process that sieves or that refines. If they have been given an attachment of, say, 6 or 5 months, depending on the gap that shall have been found, the time and they complete that time, they will get another opportunity, because this time around the university is still responsible for that product. Then the university will represent this person to the professional councils, which professional councils will confer unto these practitioners, unto these people, provisional practicing licenses that will give them the mandate to touch patients. And then they will be drilled again. If they pass or they meet the requirement, then they will be able to cross over to the practice side. And that is the intent, that is the background against what that principle of delayed graduation is premised, to cure the lacuna where we were having people hanging in no man's land and therefore becoming a danger to both themselves, but then also the population, as we have had here. I agree with much of the submissions that have been made here, that the principles and the principle of the argument or the debate is not really on the quality of healthcare providers that we're training, but rather on money. And therefore, what money has been availed, everything will be resolved. Colleagues, I would wish to say this. Let us not focus on the money that was being paid out during medical internship. That money was not meant for development. That money was not meant for any forms of luxury, but rather it was meant, or it is intended, to facilitate a candidate undertaking medical internship for their accommodation, their transport, and their meals, especially where an internship training center is not providing that. And I would wish to dispel one myth or one wrong that has been made of interpretation of this policy. The government of Uganda has not withdrawn its support for medical internship. Rather, what has been done has been a reduction in the number of people that are going to be supported therein during medical internship, and the focus has been shifted to specialization so that we can have more specialists to fill the human resource structures that have been provided, so that we are able to achieve our national agenda on specialized healthcare services in this country. If you go and look for critical care nurses in this country, you will not find many, because we have not been intentional about training those critical care nurses. If you go and look for neurologists in this country, if you go and look for neurosurgeons in this country, you'll find a paltry number. Why? Because we have not paid attention to that. And yet you'll find a huge number of generalists that are not adding that much value onto the country as compared to what the specialized or the specialists would do. So the country took a decision which was expressed through the National Development Plan 4 and also echoed in the National Health Sector Strategic Plan of the Ministry of Health, to undertake specialization as its core priority for the next 5 years, because a National Development Plan is valid for 5 years. And that is the direction that we are going to take for the next 5 years. But as this policy will be implemented, it will be also eligible for review, or what we call the midterm review, after 3 years. And at that point in time, that's when we will evaluate how it shall have performed. And if there are any gaps in implementation, then at that point in time, we will make all those improvements so that the principle behind why this policy came to be are not lost, but rather it is improved so that it can align with all the expectations of the other stakeholders, perhaps that could have not been consulted or that could have been omitted as a matter of omission, if that's not a repetition. If a person desires to do USMLE, there is no problem with that. The principle is for you to be able to qualify to do USMLE in Uganda, you'll have to complete medical training, and medical training will require you to have completed medical internship. So that is the new policy, that's the new principle. And as such, we all are expected to adjust to that. For hungry people, hungry interns, a hungry intern is a danger to society. All those principles have been provided for in the policy. Read the policy, colleagues, go and read the policy, and you will appreciate that whatever we are discussing and debating about here is in the policy. I would have appreciated it if we had taken time to first read and acquaint ourselves with the principles that are born in that policy, and then we come and debate on aspects of substantiality or fundamental points, so that we are not losing time on trying to argue on issues that are coming from a point of not having read the policy and acquainted ourselves with those principles. By and large, I think that's what I needed to speak to, and I will request the moderators of this meeting, to allow me out so that I can be able to attend to other issues. And we can always have another engagement so that we can be able to expand on this meeting. It's my duty on behalf of the Ministry of Health to disseminate this policy and ensure that you, as our stakeholders, are able to understand what this policy is. And primarily, I would wish to indicate to us that I am a doctor. I am not a non-medic, that whatever I'm talking about here, I do not appreciate. No, I am speaking from basic principles of appreciating what it takes to train a medical doctor in this country. One of the people asked what is happening to the graduate nurses and graduate midwives in relation to the principle that was already outed or provided by the Minister of Health. The guidance in that regard is we have two streams of people that train for graduate nursing and midwifery. If you're a direct entrant, meaning that you completed senior 6 and you joined university to do your graduate nursing and graduate midwifery, you'll be expected to do internship. If you are an extensor and you are on the completion pathway, government provided guidance on that, in the sense that you will be seconded or forwarded to your professional council, that is the Uganda Nurses and Midwives Council, which will administer an assessment. And if the council finds you deficient in the principles that they will be assessing for, they have the mandate to attach you to a hospital for the duration that will be determined by the gaps that shall have been established. The duration can be 5 months, it can be 6 months, it can be 3 months, it can be a year, the equivalence of internship. And during that time, the principles shall be prescribed on what exactly you'll be expected of during your attachment. Thank you, moderator. Thank you, everyone that has made it to the call. I'm glad that we are ending the call in respect of one another, and we're not hurling insults against each other. And I kindly request that going forward, we continue listening from each other until we're able to understand one another and continue working together as civilized people. Thank you.
Thank you very much, Dr. Reni, for your submission and for taking off your time to come and enlighten us about the policy. I believe we all have a better understanding of the policy than we had at the start of this meeting. I would like to request our president, Amon, to come and give a few remarks before Dr. Reni can leave.
And Nora, you have been unmuted, please. Nora.
I think Amun is off the call. Yes, then I'll request Ralph to say a few things before Dr. Reni can leave, if he hasn't left already.
I'll be here until you discharge me, ma'am.
Okay. I was failing to get unmuted. I was still on. Thank you, Dr. Ronnie. Thank you, everyone that attended today. This is why I really requested you to come and address medical students to understand the policy than what we're interpreting or reading. As earlier communicated by the minister, by Uma and other people, we request for subsequent and more engagements on this as we arrange. And I think we're going to have a few representatives of the medical students at each university, the president of each university, to have a time and meet you physically about the same discussion. I will not have any other comments to put across in regards to what we have listened in and what people have asked, but we shall deliver this information to the rest of the medical students. In the other arguments that we still carry, they are there are good things about this policy, but they are those ones that really are very, very not conducive for the medical students. And that's where we are still putting a nail, mostly in terms of facilitation. And I know things change a bit later, mostly with the government in planning, because at one time, the way they were paying interns and they changed to a different amount. So this one can still remain a point of discussion with the ministry. So as you have accepted as the consumers of the policy, I'd request that the ministry also gives us a chance to sit down on a table and have the dialogue to re-listen to us as the stakeholders about the real matters that concern. This one was the nature of the environment that I really wanted you to listen in to hear from what the medical students have on their side before everything moves as the ministry and of education and health have planned. So we really expect a much more dialogue that from our side of the medical students, we still say that we need a dialogue to still be engaged together with the ministry. And if you give us that chance, but probably in June, then we could meet and discuss further about this policy. That's what we request. And I believe that you'll give us that chance and empower further discussion. Otherwise, thank you for the time. And I request that you keep giving us your time for further clarification and whatever comes upon. And could there be any more chance of any consideration in this matter? Please let us be the first people to get it immediately and disseminate it, because everything can have a time. There's nothing that can really fail to change, mostly when it is not feasible to the consumers if there is a complaint. With that, I would request that we allow you to exit, but after giving us the last remark and any other meeting time and agreement, maybe on the physical engagement with the ministry, a few representatives from the students' body, and then with that, we shall call it an evening. Thank you, everyone that has listened in. Thank you.
Yeah, thank you so much, Jake. Amon, for making time to organize this meet. Very, very important. I'm sorry that I kept us waiting for about 45 minutes. As Dr. Frank indicated, we are having a challenge in the country, and I laid the case management pillar on that regard. And we had a meeting that dragged longer than usual. So I'm tendering in my apologies for that. It wasn't in disrespect of your time, but I had an engagement. Going forward, the same way we organize this meeting, Amon, should be the same way we continue engaging. Reach out when we have a window, we will be able to speak to us. This policy was made for the public and it should be consumed by the public. There is nothing that is in that policy that is out to be hidden or rather that was done in bad faith. And it's my duty to ensure that all of us as the key stakeholders consuming of this policy understand it. There is a clear dissemination plan that has been laid out involving both the Ministry of Education and Health, and at an appropriate time, we'll have perhaps a wider dissemination exercise or engagement at which we will be able to share more and you'll be able to ask the questions that you require. But I kindly request that for all of us that came to this meeting before we read the policy and we are seeking to be educated from this meeting about the policy, that is a very dangerous approach that you're choosing to adopt, because you will not get the basic principles against which this policy was intended, because depending on what your endpoint is, you will interpret the policy in that regard, and you lose the context within which the policy was developed. And I kindly urge all of us, by the time we return to the next call, we should have at least read through the principles of the policy. It's about 30 pages, not very long. Many of the sections do not concern you. Just read the preamble, read the objectives of the policy, and go to the sections that concern you so that you can be able to understand against which background was this policy developed. When we were developing the implementation standards, what exactly were we trying to address that is existent currently? And when you read the guidelines, what exactly were we seeking to cure in making sure that whatever principle has been put in place is enforceable? You've heard me talk about the requirement on government to recruit supervisors in the hospitals. That is a tall order that requires providing wage so that specialists are provided in the hospitals. That is a tall order that government has put on itself, meaning that government is interested in making the training environment conducive for all of us and making sure that when we are in the hospitals, we are learning, as opposed to where we currently are, where we are indicating that we take on a bigger load that should be taken on by other people. There are mechanisms that have been put in place to ensure that each and every supervisor is brought to account for the services that they are supposed to offer. There are key performance indicators that have been developed with clear tracking mechanisms, and all this is provided for in the policy. So I kindly request that all of us go back, read the principles in the policy, read it together with the implementation standards and the guidelines that are intended to enforce it. And then by the time we return to this call, we'll be speaking a little more candidly from a point of information from one end and to another. Thank you so very much, Amon, and your team for making time and for making this happen. Good evening, all of us, and happy weekend.
Okay, thank you so much,
Faisal,
Dr. Ronnie. Finally, I will say we get a conclusion from Uma, Dr. Kabwera. Yes. Yes, please.
My question is that is this going to be recorded, you people? We need the recording ASAP. We need that recording now because I believe it was on record. We need that. Can a recording be made available?
Available. It's available. Let's. I would like to conclude this meeting with Dr. Kabweru, who will give the remarks to close this meeting from Uganda.
Hello.
Yes, doctor.
Yes, please.
Okay.
If Doctor, I don't know if